Hello, my friends, and welcome to the Pathway channel. Today, I will share with you the slide for diverticular disease. As you can see here, this is an interesting one, and this is the mucosa. And we have the layers will be 4 layers: the mucosa, the submucosa, the muscularis propria, and the serosa. And in the diverticular disease, it's just herniation or outpouching from the gut wall. This is what is meant by diverticular disease. And it can go like true one, where all the layers, the 4 layers I mentioned, will go herniate, or it can be a pseudo diverticulum, as we will see here, and this will only include the mucosa and the submucosa, and they will go outside and penetrate into the muscularis propria. So let's see here. These are the layers of the gut, and we have here the mucosa, we have the submucosa, and this is the muscularis propria. You can see how big is it. Okay, and let's see how far this mucosa and submucosa will go down. So now they started to penetrate into the muscularis propria. It's on both sides, and they will go deep until they will penetrate into the muscularis propria. And this is what we call the pseudo-diverticulum, or we call it a diverticular disease. Usually this happens at a weak area or a weak spot, where the blood vessels will enter the places where we call the vasa recta, where the vasa recta penetrates. So these are the areas where these diverticula will happen, or diverticuli will happen. And it's most commonly on the left side or the left colon due to pressure on the wall. The risk factors, it may happen with age, it may happen with decrease in the fiber content in food, with decrease in stool volume, and also with decreased activity. So I'll show you another slide for this patient. This is another slide. Let's go directly to the pathology here. We are at the 2.5x. So this is the muscularis propria. You can see it's it's a huge one, and this is where we have the mucosa and the submucosa, and let's see how deep they will go. So this is the muscularis propria. Maybe it's not evident on this one, but this is the muscularis propria, and you can see that the mucosa and the submucosa, they went beneath, or they penetrated this layer here. Yeah, because the muscularis propria is on both sides. So this is one piece of the muscularis propria, and this is the other piece. And this is another outpouching. So again, the submucosa and mucosa, they went and they penetrated the muscularis propria, which is shown here as one part and the other part. This is the bulky muscularis propria. Maybe the last slide here to show you. This one, just to give you good idea about this disease. So this is, again, we have here the mucosa, and it will go deep. See, as if a tunnel is formed between two borders, muscularis propria, and it will go deep until it will almost here, it penetrates into the muscularis propria. So this case was diagnosed as diverticular disease without diverticulitis, because sometimes we can see many inflammatory cells, and inflammation can happen on top of diverticular disease. And this is the serosa. Thank you so much for watching this video. Please like and subscribe to see more videos.